Niye ne kwenda gayo menyage ni genaga muna niwe todo ne utekaga wega na ukanyenda igosyo de Idiosya
Impact's aim is to prevent causes of disability, getting into the communities that are kind of marginalized by the government, communities that don't have proper access to healthcare.
The objectives of the impact are rectify any of the problems that, for example, deafness, blindness, and mobility, the disabilities which are there. And impact has fortunately taken a holistic approach to this entire thing, that you find the problem, but you need to also look into the cause of the problem.
What Impact does is we have a team that goes out to the field every day, to the schools, to the community, and basically gives them proper health education. We also try and assess them by screening for any ear ailments, generally ENT, ear, nose and throat, but we specifically concentrate on the ears and the eyes.
Never expected them to be so many. You know, in this place we have no hospital near. Actually, from here to the next hospital is about 7 kilometers from here, where you can get another health facility. So actually it is an advantage to be here. We have seen so many patients with ear problem, cerumen or blocked ears with wax, problem with the eyes. We have referred about 10 to get glasses in Embu, cataracts who need operation. We have referred a number of them to Embu Hospital. Others we are treating them here.
Most of the countries where impact is present, it is found that the problem is nutrition and hygiene, sanitation, lack of water, immunization, etc. You know, so going to do outreach programs, besides detecting the people with disabilities, there is a group that also teaches them how to prevent this disabilities coming in the future.
When we come to schools about the health program, before Impact came, let's say just when we came, there were so many children with skin conditions, especially the tinea capitis and tinea corporis. That's the ringworms that affects the scalp and the skin. So when Impact came in, Impact donated medicine that is being used to apply on the ringworms, and there is a lot of changes. In a school where Impact has visited, you'll find that let's say 50% to 60% of children have been cured of ringworms, though it's a challenge. It's somehow a challenge because it also takes the hygiene of that pupil. He or he has to participate in the hygienic side of it.
We are grateful to Impact. They have trained health monitors in this school, children who are now aware of the minor injuries, minor ailments, and they are able to chip in when the children are suffering, and they are able to assist them. You know, learning involves a lot of hearing, a lot of sight, and when there is a problem of the ears, then you find that the children cannot be able to learn well. So we are very grateful that our children are now healthy and they are learning well.
I enjoy helping the other people when they are in need, and maintaining cleanliness in the school, planting trees in the school, and protecting the environment, taking care of the environment.
So most of them, this is a very poor settlement scheme, and when the parents moved from the places they were moved from, they settled here. They are poor and their living styles are not good. So when Impact came, they talked to the parents. Most of them did not know whether their children had some diseases. So they could discover when they were told. They could teach them, they advised them, and they brought some drugs for their children.
Now we can be able to do all ear surgeries here. Before we would have to refer them to Nairobi, but now with the incoming of Impact, all that has stopped and we'll have to do them here. So it is a major milestone which has been brought about by the partnership with Impact. We've been able to screen over 2,000 children. Those who require corrective surgery now are being referred to the hospital, and then now we are planning routine surgeries for them.
The equipment has really assisted us. Like our theater is now fully operational. We have a very good table, which has made us working easier because you can adjust the height and even the stools. The microscopes are good and they're working. So we are even getting better results now than previously.
During the surgical camp, the team of doctors from Nairobi basically operate on these kids and do all this reconstructive surgery totally for free.
The need for ear camp comes from the fact that there are very few ENT specialists in this country, and those that are there and have ability to do ear surgery, they don't have the necessary equipment. We've got an ENT clinical officer who prepares the patients, identifies them, and then we take a team of ENT surgeons. We take a team of that includes nurses and anesthetists. We usually operate for about 3 to 4 days on these patients, and then the clinical officer follows them up.
Ndo napata nafuu, kwa hiyo ikafikia muda hata ile taka ikaa sasa stop tena, wala halimuumi. Sasa ilipokuwa ndo upepo tu unapokuja na kurudi, unapokuwa mkubwa kwenda huku nanuuma. Kwa hiyo baada ya kunuuma nikaona matibabu yapo pale.
So with a group of say 4 doctors, we managed to go through about 40-45 surgeries in for about 5 days. You see that they found over 250 children requiring surgery So your idea is also to try and make sure that you make all these children get better hearing by this surgery.
We have to factor in the transportation of the patients from their villages all the way to the hospital. Some of these patients live really, really far from the main roads. So we pay for their transportation, we pay for their food, we pay for the accommodation also during the surgical camps. So we pay accommodation and food for the parents as well.
These children that have been identified early and treated have been given a chance to compete on an equal level with those children who have good hearing.
There are so many people in need. We always turn down so many people because we cannot handle the numbers. And of course, if we had the funds, we'll do a lot more.
Some of our first work was really in reaching out to children in our community that had crippling deformities, either from congenital abnormalities or from poor care of injuries during their childhood, and also a particular problem that we have in this part of Africa, which is too much fluoride that exists naturally in the drinking water. This results in the children growing up with bent and painful legs. And so for well over a decade, we've been involved with going out into the community to find these children, convince their parents that we would be able to help them, and then provide for them the surgical care that they need. It's been a great help for us to have Impact standing behind that, providing us some of the support to allow us to care for these children. It's an amazing story when one realizes that some of these children were able to find them in the village, bring them to the hospital, operate on them, and keep them for aftercare for up to 6 or 8 weeks, all for a cost of around $300 in the international funds. So it's an amazing impact that we can have for a very minimal investment.
So it's very good to give them, it's quite a simple operation orthopedically, but it gives them straight legs. And that means a lot for them to live and to survive in a very difficult environment. Having straight legs means that you can walk, that you don't have to beg, and then, yeah.
Plaster House is a place for kiddies to be essentially while they're in plaster casts. So it started with a lot of extra orthopedic cases that we couldn't house after they'd had surgery. So we have kids here who are after orthopedic surgery, after plastic surgery, and after pediatric neurosurgery, so spina bifida and hydrocephalus. The kids are brought here when they first come in from the village. They don't get taken to the hospital straight away. So they get brought here together with their parents. The parents see where the kids are going to stay, and then they leave them here and they get looked after. So this one has had the burn scar contracture released here and has a splint on now. And there's a scar on the other arm as well, but it didn't mean that her arm would continue to be bent. You can see there's scarring around here on the hand. So they do a relatively simple operation to sort of open the skin up and then straighten it out, and we have to keep it splintered for usually about 4 weeks, and then they go into night splints. The little girl came in with very, very knocked knees. The one who's closer to us here had very, very knocked knees and had the legs straightened out. She comes from an area where there's an enormous amount of fluoride in the water, which is what's causing her deformity.
The main problem is actually convincing the parents that the kids can really get the treatment and they can get normal and they can do whatever. That's a big problem, because it is really hard to convince somebody to really believe that this kid can be operated and she can really go to school normally and do everything normally. So that's a big, really problem.
So she's saying she got this problem because of difficult labor. It was 14 years ago and it was the second pregnancy. She had labor for more than 20 hours at home. And then later she went to a hospital. The baby stuck at the pelvic bone. So they had to deliver by instrument, and 10 hours after delivery, she delivered a dead child. Already the child was dead. And 10 hours later, she experienced having a fecal incontinence and urine incontinence, both.
Fistula surgery is a very addictive surgery. It's one of the few operations that you can do that will completely transform someone's life. Often these ladies come, they're in a desperate state, they've been leaking urine for 10 years sometimes, and they're just desperate to be cured, and they've been having a miserable life all that time. So within a 10 minute sometimes, or a half hour sometimes, if they're complicated 2-hour operation, and then 2-week hospital stay, then the vast majority are cured. And just in their countenance, even you can see it in their face, they're just completely transformed and happy and looking forward to going back home.
The school was very dry. Initially, when they came, they found us there. They found the school very dry, and they encouraged us to plant trees. They promised to sink a borehole in our school, and they came, brought the seedlings, sank the borehole. Then the borehole assisted us in watering the seedlings.
As you can see, it was dry. There were no trees. Although the school management tried to plant trees, the trees usually, because of the harsh conditions of the weather, this place is usually very dry. They were not able to take care of those trees. So Impact East Africa introduced them to trees, and they taken up the project. We gave the trees about more than 2,000. And also Impact went ahead and drilled a borehole for the school and the community, where they get water to water those trees.
We have got a borehole which we have drilled in our school compound, which has benefited the children, the parents and the teachers and the entire community at large, especially in the planting of trees and also growing of vegetables in the kitchen gardens. The children are also very healthy because of this. They used to drink water which we never knew where they had fetched from. But now we are very much assured this water is okay for the children. It's very nice for plants to water, and it's very okay for irrigation.
I am happy because of the borehole. I use the water for cooking. For my animals, I water them with the water, and I use the water for cooking. And I am happy because the borehole has helped me very much. I don't go far fetching water because I'm just near the borehole. So I use the water in many ways of helping me in my family.
Who introduced the planting of trees in this school? Impact East Africa. Yes, Impact East Africa. They brought us trees, shown how to plant, cared for them, and now we enjoy it. Thank you, Impact East Africa. Bravo.
We started developing water units in the community where they have no water supply from the government mainly. We have some criteria for us to do the unit, and one of the criteria is the community must have dug the well, and they should have a water pump before we put the minaret. Main reason is we want the community to feel that they own the unit. We are just coming in to support them. Most of the people used to tell us they used to spend 2 hours in the morning before starting their activities looking for water. Because now he can't leave the house if the house doesn't have water. But now they are happy. They say, I just go out, fetch the water. I spend less time and I use my time to try to find jobs to do.
Hapa na mnara tumefaidika zaidi kulipokuwa hapa na mnara, kwa sababu maji yakiwa kwenye mnara pale, maji ndio yanapo katika umeme pale, inakuwa tunapata nini? Maji kidogo, lakini tenki letu ndio kama tulivyosema ni dogo, na ikiwa hapa na mnara itabidi maji yafunguliwe kwenye mashine pale, itakuwa hatuna pale pa kuwekea maji ya hakiba. Wanajisikia faraha, wanajisikia raha kwa sababu maji wakija yakiwepo, kama kuna umeme yanapatikana, na ikiwa hapana yakikatika umeme itakuwa nini? Tunapata usumbufu. Mwanadamu anapokuwa pahali maji yanapatikana, basi anakuwa anajisikia nini? Faraha, na yakikosekana anakuwa nini? Anajisikia nini? Usumbufu.
So we have been able to take healthcare closer to the people and also filled the gaps that are there that the government healthcare service is not able to provide because of financial constraints.
To us, I should say to most of us, what is so important is to see the satisfaction of the patients. If the patient is unable, for instance, unable to see, and then you give the spectacle, he walks back himself. This is something which all of us will feel proud, and far more to himself, of course, because he was fully needing support, and now he's back to his independence. And it's unbelievable. You see, sometimes this thing, sometimes when they tell you, I don't know, how much you feel happy is unexplainable, I should say.
My motivation was, I have to do this. It's difficult to say why. Just not wanting to miss it anymore.
It's just that compassion that you have in your heart to say you need to do something for the needy people. I think it's a question of opportunity given by the Almighty to say, do this, and you do it.
We do appeal for assistance to be able to continue these year camps. Every time we go to an year camp, we find somebody who has been suffering for very many years but had no access, and they are so happy to get the treatment. They're so happy to have their hearing restored. They're so happy to have their ears cleaned and treated.
None dako hoyo to magegwe.